Hi, my name is Steve Arthmeyer. I am one of the physical therapists that might be seeing you on the floor after your back or neck surgery. You will be seeing possibly occupational therapy and physical therapy during your time. Now, after your surgery, you have some restrictions. The best way to remember that is the BLTs, we call it. And I know what you're thinking. It's not bacon, lettuce, and tomato, but it stands now for bending, lifting, and twisting. And I'm going to break that down and make that a little easier for you. So the B, the bending. Now, after your surgery, doctor doesn't want you to bend more than 90 degrees at the waist. So that's the angle I'm pointing at, is my waist at 90 degrees. So the best thing to do at home is sit in a chair with good armrests. This is the way it's going to look to get up without bending more than 90. So right now I'm at 90 degrees. To stand up, I'm going to push with my arms, and then I'm going to push with my legs the rest of the way up. Another thing about sitting at home is when you're sitting at home, you want to sit with your feet on the ground. If you sit with your legs out, over time, all that pressure goes straight through your spine. Another thing is, if you ever had shooting pains down your legs, those long nerves in your legs can be stretched and cause some more pain. So the best thing to do is to sit with your feet on the ground if you're sitting for longer periods of time. Another thing about sitting is you don't want to sit in a chair that is dumped backwards, where your butt is here and your knees are here. If you are sitting with your knees above your waist, like I am right now, you are breaking that bending restriction. So you can always, if your chair is dumped back or too soft, you can always put a pillow under your bottom to make sure it's nice and level. And if your feet don't touch the ground in the chair, you can always try to put a pillow behind your back to boost you forward. So the next restriction that you have is lifting. So you have a 5-pound weight restriction for the first week or two, up to your physician and doctor to increase that at any time. But to give you an idea, a gallon of milk is 8 pounds. So about half a gallon is your limit at first. When you are lifting something with weight, make sure that you're lifting and holding it close to you. The further away from your body is more stress on your back. Another thing about that lifting restriction is you do not want to pull on objects. So you're not pulling yourself up to stand. If you do have a car with an overhead handle, you don't want to pull yourself up into the car. And lastly, you don't want to pull yourself up the stairs. And your last restriction is the T is twisting. So make sure if there's things laid out in front of you, like this tray table is here for me, make sure you're reaching with the arm that's closest to the object. So right here. Don't be reaching across your body because that's going to cause you to twist. And another thing is, with twisting, if you are standing up and there's objects next to you, make sure you are moving your feet towards that object, not twisting. I know it's a natural tendency, and it's easy to forget that, but make sure that your shoulders and hips are in good alignment at all times.